Thank you. Good morning, everyone. I'm sorry I wasn't here yesterday because obviously I missed a lot of really important and exciting information. When I was preparing for this, I went back to my notes from the early days of my time at CDC when we were dealing with the anthrax in the male situation. And I realized that my entire career has been punctuated by outbreaks of infectious disease, starting with AIDS when I was training, all the way to this morning when I'm trying to figure out how to get more doses of Ebola vaccine to the DRC to deal with the horrible situation that's unfolding there. And the sad part about all of that is it's deja vu all over again. Every time we have one of these infectious disease threats, we go through the cycle of, it's not always panic, but we go through the cycle of intense focus and attention, investment, planning, collaboration, coordination, and then we relax into a phase of inattention and dispersion. It's like we have attention deficit disorder on these topics. When we had the anthrax situation here in the U.S., we did a series of after-action reviews when we were back in our normal state. And we brought in clinicians, we brought in laboratorians, we brought in the FBI and law enforcement, we brought in hospitals, we brought in public health officials, we brought in any group of stakeholders that might possibly have interacted in the conduct and response to those very frightening days of powders in the mail. And we could summarize all of that learning in a series of words that start with the letter C, like collaboration, coordination, capacity, competency, clinicians. There were a series of very left-brain things that we understood we needed to be able to do better as a CDC and as a nation to respond to any emerging threat, whether it was intentional or natural in origin. And I think that was the start of a journey that the CDC is still on to try to augment and expand its capacity to manage not just domestic threats of an infectious disease nature, but also to participate in the response to the international threats. And at least from the outside looking in, I think the agency is increasingly well prepared to do that. But it's happening in a right-brained environment. And the right-brain environment is the environment that allows people to get very revved up when something happens and then relax into that state of inattention. And that's that right-brain situation that doesn't sustain itself when the action is over. So I've thought a lot about that. You could read all of the after-action reports, after anthrax, after SARS, after avian influenza, after the influenza outbreak that occurred in 2009. You could read what happened after Zika, and I'm sure you'll be able to read it after MERS and anything else. They all say the same thing: sustained investment, global leadership, and continuity of preparedness over the arc of time. And why it is that we don't seem to be able to take what we know in our left brain and translate it into the kind of action agenda necessary to create a better global preparedness is something that obviously we don't have the secret to at this point in time, but there are a few things that I think come out of that context. When people are engaged and recognize threats, they do the right thing. So how do we help our leaders and our investors, so to speak, to perpetuate that investment even when there isn't an imminent threat in front of them? One of the ways of doing that is to really institutionalize the exercise and practice. I would say maybe the high watermark of domestic preparedness, and perhaps from, based on, your situation, international preparedness was when we really galvanized the entire country around pandemic preparedness. There was a period of time when the leaders of the Department of Health and Human Services, I see Bruce Gellin here, Bruce remembers this very well, we literally went to every cabinet secretary in the United States government with a book about 1918, highlighted in yellow the parts that were most germane to the actions that they needed to take. We gave them the book, we had an ask, you need to prepare your department, here's what your department needs to do in the context of a pandemic. Exercised at the federal level, and then at that time, Secretary Mike Leavitt went with Bruce and others from the department. We went to every state in the country, met with every governor and every state cabinet, including the multi-sectoral leaders of the education department, the faith-based organizations, the ag department, anybody who is likely to have a decision role in managing a pandemic, sat down with them and exercised a response plan for influenza. And in many states, including my home state of South Dakota, where my mom lives in a little town, cascaded into the community level. So my mom participated in a pandemic preparedness exercise in Brookings, South Dakota, that was a cascade from all of this activity. That took money. And we had the resources and the budget to be able to support all of that at that point in time. That budget doesn't exist anymore. It's gone. And so I think one of the things that I hope come out of these kinds of discussions here at the National Academy, the opportunity to get the urgent message across that we need to restore our ability to do these things nationally and globally. And we need a budget that stays beyond the threat. And that just has to be something that I think we stand strong on at every level of decision making, but also to prove the point, to engage in these kinds of exercises, because once people participate in an exercise, they get it. Suddenly it becomes very real, and it makes, even though the threat may not be imminent, they can imagine what it would be like, and they recognize the gap between what they are able to do now and what they need to be able to do. So leaders at every level need to really advocate for sustained budget for preparedness planning, and then to use that budget to establish as a routine the opportunity to plan and exercise the scenarios that would be most likely to plague us. I think a second piece, and I know I'm supposed to be talking more from a national perspective here, but I just have to say it, we need a strong WHO. We are not supporting the WHO to be the global leader in this kind of situation, and rather than pick apart what the WHO doesn't do well, I think we need to work harder to support and invest and to help the WHO become the global leader for preparedness efforts, because there is no other place to go for that kind of activity. And we have a lot of people, KG included, who've been there and who understand what the capacities are, but also understand the gap in what they could do if they were properly supported and really had the confidence and engagement of, the governments around the world that rely on their ability to coordinate what is almost always a global situation. So I would just put those two things out there. The last point I'll try to make very quickly is that the commitment to do what we need to do is personal. And, we have these meetings here. There are other meetings. I see Steve's here. We are working on this at a CSIS level. There's the Blue Ribbon Panel. Lots of people are working on this, but we're working on it in silos. And we need to build a stronger coalition of commitment to really move the needle on the dial. I'm like UKG. I don't think we want to wait until some next tragedy is upon us. Mother Nature is teaching us a very good lesson. We had SARS, that was 8,000 cases, 800 deaths, 10% mortality. We had the 2009 influenza, which spread rapidly everywhere, fortunately not an exceedingly high mortality rate. Pretty soon, Mother Nature is going to come up with one that spreads rapidly and has a very high mortality rate. It's just, she's playing with us. So let's not wait until we get there. Let's really pull ourselves together to try to do something now. Thank you. And yes, I'm agitated.